Welcome everyone to Natural Healing Guide's comprehensive guide on tackling one of the most common yet discomforting health issues we face, phlegm and cough. Whether it's a persistent tickle in your throat, that heavy feeling in your chest, or the constant struggle to clear your lungs. Dealing with these symptoms can be both exhausting and frustrating. But here's the good news. Relief is closer than you think. In today's video, we'll walk you through a variety of natural and safe methods to soothe your symptoms and offer comfort, not just for adults, but for babies too. From home remedies that you can easily find in your kitchen to effective techniques and daily habits that prevent these issues from taking hold, we've got you covered. Our goal is to empower you with knowledge and practical solutions to tackle phlegm and cough head-on, ensuring you and your little ones can breathe easier and feel better. So, stay with us as we navigate through these tried and tested remedies, ensuring relief for everyone in the family. Let's get started on this journey to clearer breathing and healthier living. Causes of phlegm and cough. Phlegm is a type of mucus produced by your respiratory system. It's not inherently bad. In fact, it plays a crucial role in protecting your lungs by trapping irritants like dust, allergens, and bacteria. However, when you're sick, your body tends to produce more phlegm than usual, which can make you feel congested and uncomfortable. It can vary in color, ranging from clear to yellow or green, indicating different things about your health. Coughing, on the other hand, is your body's natural way of clearing out phlegm, irritants, and infections from your lungs and throat. A cough can be acute, lasting less than 3 weeks, often due to a common cold or respiratory infection, or chronic, persisting longer, possibly due to allergies, asthma, or other long-term conditions. So, why is it important to address phlegm and cough? For starters, excessive phlegm can lead to blocked airways, making it difficult to breathe, speak, and even sleep. Moreover, ignoring a persistent cough can be taxing on your body and may signify underlying health issues that require attention. Common causes of increased phlegm and cough include viral infections like the cold and flu, allergies, asthma, and environmental factors such as pollution and smoking. Even dietary choices can play a role, with dairy products sometimes increasing mucus production for some people. Understanding these triggers is key to managing symptoms effectively. But more importantly, taking steps to clear phlegm and soothe the cough not only provides immediate relief, but also helps prevent potential complications such as infections or worsening of chronic respiratory conditions. Now that we've covered the basics, let's transition into the remedies that can offer relief, especially for adults. Dealing with phlegm and cough doesn't always require a trip to the pharmacy. Many effective treatments can be found right in your home or through simple lifestyle adjustments. Whether it's a warm tea to soothe your throat or specific breathing techniques to clear your lungs, we're about to explore a variety of options that can help you feel better and breathe easier. Home remedies to remove phlegm from the throat. When it comes to finding relief from phlegm in the throat, many of us seek gentle, natural solutions that we can easily apply at home. Here are some effective home remedies that have stood the test of time. Warm salt water. Gargle. Salt water is a simple yet powerful remedy that helps reduce phlegm. The salt helps to draw out moisture from the mucous membranes, which can reduce swelling and make it easier to expel phlegm. To use this remedy, dissolve a teaspoon of salt in a cup of warm water, gargle for 30 seconds, and spit it out. Repeat this process a couple of times a day for best results. Honey and lemon. This combination is a classic for soothing sore throats and cutting through phlegm. Honey has antibacterial properties and can soothe irritation, while lemon can help break up mucus. Mix a tablespoon of honey with the juice of half a lemon in a cup of warm water. Drink this mixture twice a day to ease throat discomfort and reduce phlegm. Ginger tea. Ginger is renowned for its anti-inflammatory properties and can help relieve throat irritation. To make ginger tea, slice a piece of fresh ginger and boil it in a cup of water for a few minutes. You can add honey for sweetness and additional benefits. Drinking ginger tea several times a day can help loosen phlegm and clear your throat. Steam inhalation. Steam helps moisturize dry respiratory passages, loosening phlegm and making it easier to expel. Boil water and pour it into a bowl. Lean over the bowl and cover your head and the bowl with a towel to trap the steam. Breathe deeply for a few minutes. Adding a few drops of eucalyptus oil to the water can enhance the effect, thanks to its natural decongestant properties. Techniques to clear cough from throat and chest. Clearing a cough effectively means engaging in practices that not only soothe the throat, but also help expel phlegm from the chest. Stay hydrated. Drinking plenty of fluids can help thin mucus, making it easier to cough up. Warm beverages, in particular, can provide comfort to your throat. Humidify your environment. Dry air can aggravate a cough. Using a humidifier adds moisture to the air, which can ease coughing and help you expel phlegm more easily. Breathing exercises. Controlled breathing exercises can help strengthen your lungs and make it easier to clear out phlegm. One simple technique is to take a deep breath, hold it for a few seconds, and then cough gently. Repeat this several times a day to help clear your chest. Chest percussion. This technique involves lightly tapping the chest with your hands to break up the mucus in your lungs so it can be coughed up more easily. It's best done after performing breathing exercises and can be more effective when someone does the tapping for you. Strategies to eliminate phlegm from the lungs. Clearing your lungs of phlegm not only involves direct remedies, but also incorporating habits that support overall lung health. Exercise regularly. Physical activity helps improve lung capacity and encourages the movement of fluids in the body, including mucus. Even simple exercises like walking can significantly benefit lung health. Maintain a healthy diet. Foods rich in antioxidants can support lung health. Fruits and vegetables, especially leafy greens, berries, and nuts, are great options. These foods can reduce inflammation and support your body's ability to fight infections. Deep breathing exercises. Deep breathing techniques, such as diaphragmatic breathing, can help strengthen your lungs and improve the clearance of phlegm. Practice by breathing deeply into your belly, hold for a moment, and exhale slowly. Quit smoking. Smoking is one of the leading causes of excessive mucus production. Quitting smoking can significantly improve lung health and reduce phlegm over time. Stay away from pollutants. Polluted air can irritate the respiratory system and exacerbate phlegm production. Try to minimize exposure to pollutants, dust, and chemical fumes. By adopting these remedies and strategies, you can effectively clear phlegm from your throat, chest, and lungs, leading to improved respiratory health and comfort. Safe methods to remove cough from a baby's throat. Caring for a baby with a cough can be worrisome for parents. It's essential to approach their relief with gentle, safe methods while always keeping in mind the importance of consulting healthcare providers for proper advice and treatment. Humidify the air. Babies breathe easier in moist air, which can soothe their cough. Using a cool mist humidifier in the baby's room adds moisture to the air and helps loosen mucus, making it easier for them to breathe and potentially soothing the cough. Hydration is key. For babies over 6 months, offering small amounts of water can help keep their throat moist and relieve coughing. If your baby is younger or exclusively breastfed, continue breastfeeding on demand. Breast milk provides hydration and has immune-boosting properties that can help fight off the cause of the cough. Elevate the sleeping position. Elevating the head of your baby's crib or bassinet can help minimize coughing and congestion, making it easier for them to sleep. Use a crib wedge or place a pillow underneath the mattress. Always ensure that the baby's sleeping environment remains safe and secure to prevent any risk of suffocation. Nasal saline drops and bulb syringe. Saline drops can moisten dry or thick nasal mucus, making it easier to remove with a bulb syringe. Just place a few saline drops in one nostril, then gently suction that nostril with the bulb syringe. Repeat on the other side. This method can help clear the nasal passages, making it easier for your baby to breathe and potentially reducing coughing triggered by postnasal drip. Keep the baby upright. Holding your baby in an upright position can help make breathing easier and might reduce coughing. This position can be particularly helpful during feeding times and for a while after feeding to aid in digestion and prevent mucus from causing discomfort. Gentle ways to clear phlegm from a baby's throat and nose. Clearing phlegm from a baby's throat and nose requires gentle care and patience. Here are some strategies to help your little one feel more comfortable. Steam therapy. Sitting in a bathroom filled with steam from a hot shower can help loosen mucus in your baby's throat and nasal passages. Be sure to monitor the baby closely during steam therapy to ensure they're comfortable and safe from hot temperatures. Keep the baby hydrated. Adequate fluids are crucial in thinning the mucus, making it easier to expel. For babies over 6 months, small sips of water can be beneficial, whereas breast milk or formula is adequate for younger infants. Use a cool mist humidifier. As mentioned, humidified air keeps the nasal passages moist and can help break up mucus in the throat and nose. Ensure the humidifier is clean and free of mold for the safest environment. Gentle tapping. For babies, a gentle tap on the back can help loosen phlegm. Lay your baby face down across your knees and gently pat their back with a cupped hand. This method, often referred to as chest physiotherapy, should be gentle and not vigorous. Avoid irritants, smoke, dust, and strong fragrances can aggravate your baby's cough and make phlegm worse. Keeping the air around them clean and free of irritants can help reduce coughing and congestion. Keeping your baby comfortable while they recover from a cough or congestion is crucial. Ensure they have a restful environment. Consider offering a favorite toy or blanket for comfort and monitor their condition closely. If your baby shows signs of difficulty breathing, has a high fever, or if you're concerned about their health in any way, consult a healthcare provider immediately. How to clear phlegm from throat for singing. For singers, maintaining optimal vocal health is paramount to ensure the best possible performance. Clearing the throat and keeping the lungs healthy are crucial components of this. Here are specialized tips and techniques tailored specifically for singers to help protect and enhance vocal performance. Hydration is key. Proper hydration is essential for singers. Drinking plenty of water throughout the day helps keep the vocal cords lubricated and prevents the throat from becoming dry and irritated, which can lead to unnecessary clearing of the throat. Aim for at least 8 to 10 glasses of water daily and consider increasing this amount on days of performances or rehearsals. Warm up your voice. Just as athletes warm up their muscles before a game, singers must warm up their vocal cords before performing. Gentle vocal exercises such as humming, lip trills, or scales can help prepare your voice for singing. These exercises not only improve the flexibility of your vocal cords, but also help prevent the need for throat clearing, which can be harsh on your voice. Steam inhalation. Inhaling steam is a fantastic way to maintain vocal health. Steam helps hydrate the vocal cords directly and can thin out mucus, making it easier to clear without harsh throat clearing. Using a personal steam inhaler or simply breathing in steam from a bowl of hot water can provide these benefits. For added effect, consider adding a drop of essential oil like eucalyptus, which can further help in clearing the airways. Avoid irritants. Certain substances can irritate the throat and vocal cords, leading to phlegm production and a need to clear the throat more frequently. Avoid smoking, including secondhand smoke, and limit intake of caffeine and alcohol, which can dehydrate your body and vocal cords. Also, be mindful of spicy foods and dairy products before performances, as they can increase mucus production. Healthy diet for vocal health. A balanced diet rich in fruits, vegetables, and lean proteins can support overall health, including your vocal health. Foods high in vitamins A, C, and E, as well as antioxidants, can help protect and repair tissue, including vocal cords. Incorporating foods like ginger, honey, and turmeric, known for their anti-inflammatory properties, can also benefit singers. Breathing exercises. Proper breathing not only supports strong vocal performances, but also helps maintain clear lungs and throat. Practice diaphragmatic breathing regularly to increase your air intake and control your breath. This technique involves breathing deeply into your belly rather than your chest, providing a stronger and more controlled sound. Rest your voice. Just as rest is important for the body, vocal rest is crucial for singers. Avoid speaking loudly or for prolonged periods, especially before a performance. If you feel the need to clear your throat, opt for gentle swallowing or sip warm water instead of harsh coughing or throat clearing. Regular vocal health checkups. Regular checkups with an otolaryngologist who specializes in voice can help identify any potential issues early. These professionals can offer personalized advice and treatment options to keep your voice in top shape. By incorporating these tips into your daily routine, singers can ensure their vocal cords remain healthy and free from excessive phlegm, leading to clearer, more powerful performances. Remember, consistency in these practices is key to long-term vocal health and success. How to prevent phlegm and cough. Maintaining a phlegm and cough-free life isn't just about addressing symptoms as they arise, it's about integrating preventive measures and lifestyle changes that foster long-term respiratory health. Let's delve into daily habits that can significantly reduce your chances of developing phlegm and cough and discuss when it's crucial to seek medical advice. Daily habits for prevention. Stay hydrated. Adequate hydration is key to keeping your mucous membranes moist and preventing the thickening of phlegm. Aim for at least 8 to 10 glasses of water a day. Warm teas and broths can also be soothing and beneficial. Maintain good nutrition. A diet rich in fruits, vegetables, lean proteins, and whole grains can boost your immune system, reducing the risk of infections that cause phlegm and cough. Foods high in vitamin C and antioxidants, such as citrus fruits, berries, and leafy greens, are particularly helpful. Practice good hygiene. Regular hand washing and using alcohol-based sanitizers can drastically reduce your exposure to viruses and bacteria that lead to respiratory issues. Exercise. Regularly, physical activity helps improve lung capacity and overall respiratory health, making it easier for your body to fight off infections and clear out mucus. Avoid irritants. Smoke, pollution, and allergens can irritate your respiratory system, leading to increased phlegm production. If possible, avoid exposure to these irritants and consider using air purifiers in your home. Humidify your environment. Dry air can exacerbate respiratory symptoms. Using a humidifier, especially during winter months, can help keep your throat and nasal passages hydrated. Manage stress. High stress levels can weaken your immune system, making you more susceptible to infections. Incorporate stress reduction techniques such as meditation, yoga, or deep breathing exercises into your routine. When to see a doctor? While many cases of phlegm and cough can be effectively managed at home, there are instances when consulting a healthcare provider is essential. Persistent symptoms. If your cough or phlegm lasts more than 3 weeks without improvement, it's time to seek professional advice. Persistent symptoms could indicate a more serious underlying condition, such as asthma, allergies, or even a bacterial infection that requires antibiotics. Difficulty breathing. If you or your loved ones experience difficulty breathing, wheezing, or shortness of breath, seek immediate medical attention. These could be signs of a severe respiratory condition or infection. High fever. A cough accompanied by a high fever could indicate a bacterial infection or the flu. A healthcare provider can determine the cause and recommend appropriate treatment. Unusual symptoms. If you notice blood in your phlegm, chest pain, or sudden weight loss alongside a persistent cough, these could be signs of a more serious health issue that requires immediate medical attention. Adopting healthy daily habits can play a significant role in preventing phlegm and cough. However, recognizing when symptoms are beyond home care is crucial for your health and well-being. Always err on the side of caution and consult a healthcare provider for persistent or severe symptoms. Remember, your health is invaluable, and taking proactive steps towards respiratory wellness can lead to a happier, more comfortable life. And there we have it, folks. We've journeyed together through the essential knowledge and practical steps needed to tackle phlegm and cough for adults, babies, and even singers, offering natural remedies and professional advice to ensure everyone can breathe easier and enjoy better health. Remember, staying hydrated, maintaining a healthy diet, and incorporating regular exercise into your routine are foundational steps to preventing respiratory issues. Equally important is knowing when to consult a healthcare professional to address persistent symptoms. We hope you feel equipped and motivated to apply these strategies in your daily life, ensuring consistent care and attention to your respiratory health. Implementing these tips not only provides immediate relief, but also contributes to long-term wellness for you and your loved ones. If you found this video helpful, don't forget to hit the subscribe button. We're here to provide you with valuable content that empowers you to take charge of your health. Your journey to clearer breathing and vibrant living starts with the steps you take today. So let's keep learning, keep improving, and keep moving forward together. Thank you for watching, and see you in our next video.